Hey everyone, this is my final for health policy analysis on the opioid crisis. My name is Taylor Avon, and this is for class HSC 420-8E of California Baptist University. The issue that I would like to address is the current opioid epidemic that has spread across the United States. This epidemic has affected many individuals and families across the United States, including my own. Addiction holds no prejudice. It does not care about your race, age, or gender, and can affect anyone at any time. A Bill S.425 Budgeting for Opioid Treatment Act was introduced into the 116th Congress of 2019 to 2020 on February 7, 2019. According to the CDC, each day more than 130 people die in the United States from opioid drug overdoses. Many patients that are prescribed this medication misuse them or overuse them, and many end up turning to harder street drugs such as heroin and fentanyl. This bill would affect all of those suffering from opioid addiction. It would benefit them and their loved ones who are also affected by their addiction. Health policy decisions are made by elected or appointed officials in various branches of the government, such as the House, the Senate, and even up to presidency. The bill starts out in the House of Representatives, and after floor consideration and debate can move up to the Senate. If all goes well from here, the bill can be passed to the president. Otherwise, the House and Senate will have to work out an agreement by making amendments to the bill or agree to each other's branch's version of the bill. In this slide, it shows how the prescribing rates have gone up, the number of pills prescribed have gone up, and the average supplied daily dosage has gone up. The reason why this treatment is necessary is because a person can have physical withdrawal symptoms. Physical withdrawal symptoms include nausea, vomiting, diarrhea, sweating, fever, and muscle cramps. Many people continue to use just to avoid withdrawal symptoms. It is hard to quit on your own. According to an article published by the American Physical Therapy Association, as many as 1 in 5 people receive prescription opioids long-term for non-cancer pain in primary care settings. More than 11 million people abuse prescription opioids in 2016. Every day, more than 1,000 people are treated in emergency departments for misusing prescription opioids. These statistics are shocking. Pharmaceutical companies have sat and made millions of dollars while people in our communities have struggled and sometimes even died. An overview of the bill, S.425 Budgeting for Opioid Treatment Act, was introduced into the 116th Congress of 2019 to 2020 on February 7th of 2019 and is currently still in review. The author is Senator Joe Manchin III of West Virginia, who is a Democrat. The bill would charge 1 cent per milligram fee on the sale of active opioids by the manufacturer, producer, or importer. The fee excludes prescription drugs used exclusively for the treatment of opioid addiction as part of a medically assisted treatment effort. The money collected from this fee would be used by states who are under the Substance Abuse Prevention and Treatment Block Grant Program, in which would help to provide treatment exclusively for substance abuse. The bill would also ensure that those who have cancer or who are on hospice would receive rebates or discounts. Some of the promises or expected outcomes of this bill is that treatment is expensive. This bill would help to make treatment more widely available by providing more funding. It would also lower the rates for those with cancer who are on hospice, as well as to help recruit substance use professionals to treat those in rural or underserved areas. Some of the stakeholders include Senator Joe Manchin III, the author of this bill, his co-sponsors, who are other senates, the governor of each state, the president, pharmaceutical companies, doctors, patients on hospice or going through cancer treatments, and those who have become addicted to these medications. Advocates include Recovering addicts, they can provide testimony of how treatment has helped them. Those seeking treatment, family members of addicts, treatment facilities, police, and mental health substance abuse organizations. Some of the channels used for communication would include social media, television, newspapers, meetings through legislators and others, and conferences. According to an article published on Vox.com, the author states some of the downsides to these policies could be mitigated by synergies with other proposals. If addiction treatment is more available to painkiller users, for instance, some of them will be more likely to get on treatment and less likely to turn to illicit opioids if cut off painkillers, preventing what could have become a heroin death under the model. People who do not have insurance or who live in rural areas may not have access to the proper treatment. Other people who would oppose the bill would be the pharmaceutical companies that specifically make opioids and ones that affect medications to treat the side effects of opioids. Other opposers may include people that receive the medication for pain who do not abuse it. One unintended consequence that could possibly happen is that the insurance or patient may not want to pay for that extra fee and drive them to use illegal street opiates such as heroin and fentanyl. These drugs are extremely potent, which could cause a spike in the already high overdose rate of Americans. My recommendation would be to provide treatment for anyone who seeks it. I think that Bill S-425 would be beneficial. People with an addiction usually cannot beat it on their own and require support and medical as well as psychological treatment. From a Christian worldview, it is important to help others. Galatians 6:2 states, "Bear one another's burdens, and so fulfill the law of Christ." By helping someone in need, you can completely change and or save their life. I also recommend and agree with the needle exchange program to help prevent diseases from spreading, and for the life-saving drug Narcan, which counteracts an opiate overdose, to be made available over the counter. These options may not completely end the opioid epidemic, but they might help to save lives and provide people the opportunity to recover. Thank you so much. This concludes my presentation, and I hope you enjoyed it.